Welcome to Rehab and Revive Physical Therapy and your evaluation instructional video on posture. This is Kendrew, and I'm Dr. Justin Lin. I'd be happy to show all the examples of good and bad posture. Kendrew, do you mind taking off your shirt? Some of the classic postures come in to our clinic, and what we want to do is we want to try to mitigate or lessen the blows of our postures to our everyday life and the stresses that happen to drive the dysfunction over and over again. And once we start making those corrections, the benefits will then show and carry over longer. So, Kendrew, show me a typical posture, one of the first ones that we've discussed before in the past. So, right over here is an over-exaggerated or exaggerated a curve or posturing of the spine, and his chest throws up, and a little bit of a lift of his neck. What happens here is that there's a lot of tension that can build here, a lot of that upper trap tension that you might feel that you want to massage, and a lot of tightness right here. And so some of these stress lines, Kendrew, I'm going to have you turn around. If I do something, if I do a test called the vertical compression test, functional tests are what drive us to show patients and ourselves where the stress points are in our body. So right here's a vertical compression test, and you can see I'm acting as if gravity is coming down or load is coming down like a backpack. You can see where he's going to hurt. It probably doesn't feel very comfortable for someone like Kendrew who's used to a good posture. So, and then we want to see how you strategize, because sometimes what you do then gets actually gets accentuated a little bit more. So strategies are predicated on the posture that you have. You move the way your posture is. If you're going to be this way, you're going to continue to walk that way, and you're going to continue to force your body in a position and compensate in areas that shouldn't be compensated, that brought you in here to Rehab and Revive today. So we can do something called the elbow flexion test. And right over here, so Kendrew, I'm just going to have you hold your elbow right there. Don't let me straighten it. So I'm going to try to load, and you can see that where is he going to, if he wanted to carry grocery bags, you can see that it's all going to be a lot of this. And so we want to strategize. We're going to have the interns in the room check your posture and see how you efficiently or inefficiently can carry or withstand load. Kendrew, please show a couple others, and we want to show. And so another version here is someone that maybe has had backpack too long, or someone that works on the with the floors and typewriting or keyboarding at the desk. So right over here we got the forward head posture, and then in order to right yourself, he's going to look at the computer screen, and then right over here. So you can see a lot of people in this posture, slowly they have this mid-back tension, as well as some people having the lower back or pressure on their front of their hips. Another posture here typically is some people really want to accentuate even more than the original first posture, but a lot more stress through here. And then another posture is that sunken chest posture that also is a typical one that happens in the office. So right here the neck muscles are really tight. You can see right here they're already tight on Kendrew, and he just rests on his rib cage, and some people end up actually having gastric problems because of our different postures. So thank you. You can go ahead and put on your shirt. Actually, Kendrew, you can keep your shirt off. Let's go through the corrections right now. Just like anything, habits are hard to change. So we really need to emphasize more practice. It takes something like 10,000 repetitions to really make a real change up here in our brain. So, Kendrew, what we want to do is we're going to start at the feet. We want to create a good base. The feet are like a tripod. We want the big toe, the little toe, the middle of your heel to be planted. So you want to disperse that evenly. So Kendrew, I'm going to have you shift your weight forward because your big toe and your little toe are a little bit more in the front. How do you know you're in the right place? You're going to feel your foot gripping the ground. That's the most efficient because you're working on the intrinsic foot muscles of your arch, and that's going to provide you the strength that you need from bottom to top. The next thing we want to do is we want to unlock your knees. A lot of people are tensioning their knees so much. What you want to do is you want to keep it springy. So go ahead and just do a little spring. And what you're going to notice right here at his toes is that they're gripping the ground every time to absorb shock. This is a very important concept in our body. The next aspect we're going to look about, Kendrew, is your posture at the pelvis. So we want to imagine the pelvis is like a bowl of soup. If your bowl is tipped forward, then your soup is going to come forward, and if your bowl is tipped backwards, then guess what? The soup is going to go backwards. This is very important for the upper body to now link up to the lower legs. So, Kendrew, we're going to have you you're going to still maintain the foot structure, the springiness in your knees, and put your bowl right over that. Now we're realigning what we call the center of gravity of your body over your base of support. What we want to do next is we want to think about your organs. Your organs, I like to imagine them as noodles. Let's say they're udon noodles. So we're going to drop those noodles into the bowl of soup. So you're going to have to relax. We live in a Western society where we want to keep tensioning our stomach, and that actually creates a lot of pressure buildup and recruits the muscle less. Think about hammering, and if you have a hammer and you're really stiff hammering, then guess what? There's no reactivity and no strength to the hammer or the action. So what we're going to do here, for instance, is to drop those noodles into the bowl, and that creates what we call an anchor. And then after that, I'm going to come from behind, and an assistant or one of the interns will help show you that what we need to do is we want to get the rib cage, and you want to see that now here's the organs, and the rib cage is like a lid over a pot. So we want to bring that over. I'm going to lift Kendrew over here, and I'm going to put him over the pot and over the noodles. So the lid is coming over, whether you have the posture where you're accentuated or even the one where you're at the computer. We want to bring that over. The rib cage is like a dome, and that's really important to kind of see. And so if you quickly see now, when I put some vertical load, it is now going through his whole body. To some of you, it may feel like you're too far forward, and this can be a hindrance in the way to change your habits, but just trust us that we're trying to keep improving that efficiency and that optimal alignment. So the next thing we want to do is look at the shoulder. So we got the rib cage over the bowl of soup, over the springy knees, over the over the ankles and feet that are planted to the ground. So what we're going to do with Kendrew's shoulder blades is we're going to do one at a time. Go ahead and face the camera here. What we're going to do is we're going to go up and externally rotate or turn your wrist out, and you're going to drop. It's supposed to perch on top of the rib cage. So basically you have your collarbone and you have your shoulder blade, and it should sit nicely and firm. That's when you have good stability. And on this side we're going to do the same thing. We're going to go up, and if you want a side view, you're going to go up, turn your wrist out, and you're going to drop it down. You can see that that is not straining those neck nerves and not straining over here. What we're going to do is, so you can see that I can now load a good amount, and he can accept more weight if I do something like an elbow flexion test. All these things are now ready to be recruited and to help out during our posture. It helps breathing, it helps that efficiency for strength. And then the final thing is actually your neck. And what we want to do is we think about 2 points. So there's going to be 2 points right over here, back here, and here. And we want to make them longer. And once you make them longer, you're going to feel little muscles called the multifidi muscles. They're going to retract and bring the neck back. So Kendrew, I'm going to have you go ahead and try to lengthen these 2 points away from each other. And if you need help from the intern, they will help you out and instruct you this way. You can feel little tensioning here, and so on a side view, once again, it's a lengthening. A lot of people have trouble, they just want to look up, but you keep your chin at a parallel level to the floor. So right here again, right here, okay? We'll just do that. Go ahead and elongate that and just retract your chin back. Go ahead. Wonderful. And so what that provides is you should feel a little bit of strengthening here. Now that's a good alignment. That's the head over the roof is what of your spot of your rib cage, and then the lid over the pots of the noodles, and then over that base again. So right there is a great place to live. It's very hard. It's a habit change, but if you adopt this, then you'll be able to carry over the good work that we're doing in the sessions here at Rehab and Revive Physical Therapy. We're going to now show you the strength and how it enhances our body, because now he doesn't have to work so hard to accept load or to handle some of the load that he has to use. So right there, hold right here, don't let me move you. And you can see now I can provide a lot of strength. The interns will also show you through the elbow flexion test. So once again, we want to invite you to try the new posture. Be open to this new change in habits, because a lot of what's being driven today in our bodies and the dysfunctions that you're coming in with, whether it's nerve pain, back pain, neck pain, even knee pain, has everything to do with how we started off our action. So if you started off this way, the way you walk is going to remain this way, even the way you reach. So thank you very much, and we look forward to coming to you and helping you out with the rest of your posture and your dysfunctions. Thank you very much.